Hey, good afternoon. I'm Dr. Semira Asaro, and I'm a faculty member in the Pacific College's Holistic Nursing Program. And I'm here with a colleague and a student from the program. We're just going to go around and introduce ourselves and feature um, our lovely student, Megan, on Spotlight for April. Would you like to introduce yourself?
Yes, hello, I'm Dr. Mitzie Meyers. I'm another faculty in the nursing program at Pacific College, and I'm very honored to be here today with Dr. Semira and with our student that we're spotlighting, Megan. And I'm privileged to teach Megan in a course of issues and trends this term, and she's done an outstanding job. And we're here to highlight all of her work and her progress here at Pacific College.
And my name is Megan Moody, and this is my first semester at Pacific College. I'm really excited to be a part of this program. So I've been a nurse for 16 years. I am from Indianapolis, Indiana, which is where I began my nursing career. I graduated from an associate's degree program at a community college in my hometown and worked for about 4 years before deciding I wanted to do travel nursing. So I took a travel nurse position in San Diego, California at Rady Children's Hospital, and I have worked there for like 10 years on the pediatric hematology oncology unit. And it's been just the trajectory of my nursing career and all the experiences that I've had and all the things that I've learned. And in that time, really connecting with especially what I believe is the core essence of like caring within nursing. And I really got to connect in that space in my role as a pediatric oncology nurse, and really just forming relationships with my patients and the families, holding space during really difficult times, being a support for them, educating them, providing them with all the tools that they need as they kind of move through this journey of illness and hopefully back into health again. So in the last 3 or 4 years, I had decided that I wanted to go back to school. And so now here I am at Pacific College. So I'm really excited to be here with you guys today.
Thank you for that lovely introduction. You've had quite the journey in nursing. Some very challenging clinical environments. Well, we're so happy that you found Pacific. Can you tell us a little bit about what initially drew you to Pacific College of Health and Science?
Yes, so actually, I've known about Pacific College for quite a while. I know many people who have gone through the acupuncture program, so I've always known about this college and always had a really good reputation, but I never knew that they had a nursing program. So when I initially started going back to school, I knew that in order to advance my degree, I would need to complete a bachelor's program. So I knew that I wanted to do online because I have an 8-year-old daughter at home and been working, and so I knew that doing something online was going to be really accommodating for my schedule and would work really well for me. So I got on Google and was Googling, and lo and behold, Pacific College came up. And so I clicked and found that they had this this RN-to-BSN program, which was like, oh my gosh, just so perfect. And not only was that what I needed, but also because this program offers through the perspective of holism, which is something that is so near and dear to my heart, because it's interesting, like in my role as a nurse, self-care has become such a highlight for me, obviously, being able to fill the cup back up after you go and pour out for others. And so, a lot of holistic modalities have kind of come into my path, like yoga, meditation, essential oils, all those things. And so, and to know like, okay, it's perfect because need to do this bachelor's program, but it's also through this lens of holism. So it's everything that I need, and it's something that just resonates so deeply with me on a soul level and things that I want to share with others. So I was really excited when I found the program.
Wonderful. Yeah, self-care is a huge focus in our program. Right, Dr. Mitzie, wouldn't you say that's a very important piece? Yeah.
Yes, it is. It is. And, our aim is that our students will learn that while they're getting their education, so that as you continue in practice, it will help sustain you throughout your practice and the challenges that sometimes brings.
Absolutely. I loved the phrase that you used of filling the cup back up after you've poured out, as we know, especially in today's nursing climate. It is so important in order to prevent burnout. And so we know this is your first semester. What aspects so far have you found valuable in your educational journey?
Well, first of all, like I mentioned, just the fact that it's an online program has been incredibly beneficial for me. And I feel like the way that it's set up, it's still very supported. I don't feel like I'm by myself just trying to get through this program. I feel incredibly supported by my faculty, especially both of you. You both have been amazing, and I have so much gratitude for the support that I've received from you. And even, like Dr. Lombard, she's been, I just feel like, incredibly supportive. An example that I have of that is just like knowing what classes I needed to enroll for next semester. They set up a Zoom to help us. Like it just every step of the way, I feel like I'm being set up for success, and I feel like I'm being very supported. And especially for me, coming back to school after 16 years, I was a little nervous because I'm like, I feel a little rusty, but I just feel like I've been incredibly supported and set up for success through just from day one, even the admissions process. Everybody's been so good. The communication is so clear and so supportive. The information that I'm learning has been amazing. I definitely feel like I'm getting what I need to fulfill that requirement for my bachelor's degree. But the things that I'm learning, just another example in the theory class, just these nursing theories, I just feel like I'm a little sponge soaking up all this beautiful information. And the things like from Issues and Trends, like the Planetary Health Task Force Committee that I've been able to be a part of through this, it's just all these opportunities that feel so nourishing for my soul, but they're also supporting my education. So it's just been an amazing journey so far, and I just love this program.
How lovely. It sounds like it's been a rich experience for you. I know that in the theory class, you've been doing quite a bit of writing. I'm sure in Issues and Trends also, you do quite a bit of writing. And you've been out of school for 16 years, but your writing would not reveal that gap of time, because you write really beautifully and have expressed yourself really beautifully in these assignments. And one in particular kind of stands out a little bit, a personal philosophy of holism. And, seeing students take in this information and then make it their own is quite exciting, I think, for us as faculty. Is there anything you'd like to say about particular assignments that you found meaningful in both classes?
Well, in general, the writing has been it's been my favorite part of this journey so far. I've always loved writing. I journal a lot, so I do a lot of writing in that way, and I dabbled in a little bit of blogging. But to bring in this piece of like integrating knowledge, it's just been very like enlightening for me. And this paper, the personal philosophy of holism paper. So the title of the paper is "We Are the Entire Diamond," and I guess, we were talking about self care and how all of this kind of interweaves, and just the idea that we are these diamonds. And it's through this perspective of holism, because we have all these different facets, just like a diamond. We have all these different facets, and it's composed of all these different aspects of us. And it's like, for me, sometimes I would feel like I would have to like switch on and off my hats, and I would be just kind of pigeonhole myself into this one facet and kind of compartmentalize myself in a way. And, and through the perspective of holism, it's like we're all of the things all at the same time. And so it's like I'm a mother, I'm a nurse, I'm a student, I'm a wife, I'm a daughter, and so much more. And so that's kind of the idea behind this diamond, and how supporting people and kind of being all of these aspects all at one time, and how it's like when one aspect is kind of off or imbalanced, it affects the whole. And it's like when we are at our optimal wellness, it's like all the facets are bright and shining, we are bright and we shine. And that's kind of that light that we share with people. And especially in times right now with what the world is going through, it's like we need all of us to like shine like that, because that's what's going to really help humanity get through this, I think. And I think as nurses, and Dr. Mitzie and I kind of talked about this before, as nurses, I feel like we have that special role to shine that light for people right now, and so being able to share this knowledge with others is one of those ways I think that we can do that. So that's kind of the inspiration behind that paper, and all the nursing theorists that I really admire. Yeah.
That's beautiful, Megan. Just your description is really inspiring to, I'm sure, students and faculty. It's just such a beautiful way to take all the different roles that you have in your personal and professional life, and just have it transcend, really, I think. And how wonderful that you have felt supportive from the time of enrollment until now through your coursework. I think that's really important to students who are either thinking about being in a nursing program, or comparing different programs, or maybe want to go to school but a little leery about it. I think you've given them a wonderful description of what your experience has been so far and what it can be.
Agreed. So as you move through this program, have you given some thought as to your aspirations professionally in terms of applying your education or the path forward?
Yes, so I'm definitely planning on continuing through the master's degree program at Pacific College. As of day one, I was already convinced, yes, I'm gonna go forward. And just even moments like this, it's like signs from the universe, like, yes, this is it, keep going. I foresee myself doing maybe at least within the master's degree role, something like nurse coaching, because I really do love working in that space one-on-one with people. And like I love holding space for people, and providing encouragement and education and tools. And I And, even just some of the tools I've learned kind of outside of nursing, like I've gone through yoga teacher training. And so I have like these little pieces that I would like to pull in. But I definitely also feel inclined to maybe even consider going through my doctorate, because I really love research and I really love writing. I'm a writing geek, I guess. And now that I know that there's a lot of writing coming forward, I was like really excited about that. So, um, and I've had previous experience doing research in my role as a bedside nurse. I was involved in a lot of quality improvement projects and an evidence-based practice, and I've had experience doing IRB applications and kind of that research process. So now that it's like the spark has been lit with like all the things that I'm learning even just this first semester, it's definitely like, wow, I see how I can like apply all of these things. So that's kind of what I'm thinking. And I'm, also staying open to what else comes my way, because it's like, this is just like the beginning, and I'm just really excited to see what just presents itself, what unfolds. And just kind of having that like surrender and trust in the process. So yeah, it's really exciting.
I know that makes our hearts very happy to hear that you're thinking about, continuing, and certainly in doctoral programs in nursing, whether it's a PhD or a DNP, you'll really get to enjoy the writing process a lot. So
I love that you surrender to the universe and just just go with the flow and let that energy take you. It takes a lot of trust, I think, and courage to do that, because I try to do that in my life too. So that's wonderful that you are already, possessing those skills and have that awareness and have the urge to go forth with your education, because, nurses are lifelong learners. So that's wonderful to hear.
it certainly is. And do you, Megan, have any other thoughts or ideas or anything you'd like to share that we didn't kind of touch on?
Feel so much gratitude, honestly. It's such an honor to be here, an honor to be in this program, an honor to just be among such wonderful, like-minded people. And I'm deeply, deeply, deeply grateful for like literally every person that I have encountered along this journey, because like I said, I just feel so immensely supported. And me being in school, me finally taking that step to come back to school was kind of a long time coming. And it heralds great change in my life, and this is deeply important for me to be in this journey right now. And I just feel like just synchronicity that I'm here, that this program is here, and it just like aligned so perfectly. And yeah, I'm just like really excited for what's to come, so I'm just very, very, very thankful.
We're thankful for you too, and that you found us. And thank you for sharing your time and your story with us and with other students, your peers, and other prospective students, other nurses. You mentioned earlier shining your light, and you've done that through this interview. So thank you.
Yeah, it's been a real privilege having you in class, and I so look forward to following your journey forward. And we also have the privilege of publishing your paper about your personal philosophy Polism in the newsletter. So that'll be available for folks to read about We Are the Diamond. So thank you so much. This has been fun and enlightening. And you are the Spotlight Student of April. Okay, well, that concludes our interview. Thank you again, everyone.